become better. If we have made a surgery on our hip, if it's still paining, usually after a hip replacement or a knee replacement, the most important objective of doing a joint replacement is to make it a painless joint. People lead a very good quality of life. I have had patients who have had their hips replaced, knees replaced, and elbows replaced. In fact, 6 joints have been replaced even in certain patients with rheumatoid, and they have done extremely well. So do not get frightened about joint replacement in this country. We are technically, our orthopedic surgeons and knee replacement and joint replacement surgeons are technically more sound, as sound as people done abroad, and it's a very effective surgery for rheumatoid arthritis. When we strain while doing some works, I think the question is half. I'm not able to understand that. One person has asked me, yeah. So this particular person who's asked me the question seems to have a lot of blood tests done. He's done a rheumatoid factor to exclude rheumatoid arthritis, and he's done anti-CCP, which is a refined cousin brother of rheumatoid factor. He's had an MRI of the spine done. He feels stiff in the body. I feel as if muscles situated both sides of the spine are getting stiff. Both hands, finger is getting stiff. Legs below the ankles getting stiff. I have pain in the ankles. I've consulted with rheumatologist, but after seeing my report and MRI, he said me that the disease does not pertain to rheumatology. Sir, I requested you to please guide me. Let me tell you, I don't want to mention the name. See, one important fact is what you have presented to me is just a little vague clinical picture about yourself, and you've also seen a rheumatologist. So I do not know whether he's told whether you have a rheumatological problem or not a rheumatological problem. From what I see, if the rheumatologist has excluded the possibility of any rheumatological disease in you, this can happen even due to mental anxiety and mental tension. The most important problem which people face now is stress. So stress actually gets translated into bodily symptoms, and there are a lot of people who are always emotionally anxious about their health. Health anxiety is very, very dangerous, especially now with the explosion of knowledge in the media. Everybody thinks they have all the diseases in the world. In fact, now we are seeing more COVID patients without COVID than seeing patients with COVID. Everybody, even cough, cold, even headache is there, some hair fall is there, everybody thinks it's a corona infection. So I would feel that you can see your rheumatologist again to find out whether you have a rheumatological problem, because all your lab tests seem to be normal. This is for the person who was asked a question earlier. Yeah, next. No. How can pressure be more while lying on your back? How can pressure be more? No, anybody lies down on the cot, whether he lies down on the chest or whether he lies down on the back, definitely there'll be a little pressure on the surface of the bed or something like that. Now, which is the correct posture while lying down to sleep? Preferably not to use a pillow. If you want to use a pillow, you have to use a very thin pillow which just fits into the hollow of the neck. You should lie on your back, prone on your back, or prone on your chest. And if you lie down on your side, it is always better to keep a small pillow between your thighs, but don't lie down and sleep in the fetal position. This is very, very bad. Fetal position is just lying down like this. That fetal position is something which is a privilege which a fetus can enjoy only inside the mother's womb. The mother's womb is the most safest environment in the world. When you come out in the world, don't be a fetus, stand straight and fight the world. That's very, very important. How long is it recommended to be in this correct position? Whatever correct position you ask me, if it is a correct position, you can be in the correct position for a long period of time. The problem is if you're in the wrong position, you should be there for the least period of time. Anyway, I shall be speaking about ergonomics next time, but still I can tell you a person is asking has suggested an ergonomic chair and table design and system hardware like mouse, typing boards, etc. And this I shall address in the next meeting. I'm having a special meeting on ergonomics, especially for people in the IT industry, especially who are people are working from home. Now it is not just working from home, but is also at working at home, taking care of the domestic course in human life. One patient has got joint pain and is saying his thyroid is normal, diabetes is normal. I would just like to tell you that even diabetic patients can have severe pain in the shoulder, not able to move the shoulder, and this is called periarthritis of the shoulder. They would be able to comb their hair. For me, there's no problem at all. They won't be able to comb their hair. They won't be able to have a shower bath or head bath. They won't be able to take the hands above the shoulder. So this is called periarthritis shoulder. It's a very common problem, especially in diabetics who have not been well controlled. Physiotherapy is a sheet anchor of treatment. So if a diabetic person has got shoulder pain, it is absolutely essential that he sees a rheumatologist or an orthopedic surgeon, or at least he sees a physician to sort out his problems. One person has asked a very important academic question. What is the difference between seronegative rheumatoid and rheumatoid arthritis? I told you. You take the bunch of rheumatoid arthritis patients, 80% of them will be rheumatoid factor positive, 20% of them will be rheumatoid factor negative. So those people who are positive, you call them as seropositive rheumatoid arthritis, and those people who are rheumatoid factor negative, you call them as seronegative rheumatoid. But let me tell you one thing, ladies and gentlemen, whether it is positive for rheumatoid factor or negative for rheumatoid factor, it doesn't mean much to you because you have to get treated, you have to accept the disease. One person has asked a very good question. Doctor, I have rheumatoid arthritis and I'm taking an immunosuppressant like Folitrex. Given this COVID situation and in general, taking immunity boosting medicines like ginger, turmeric, etc., is it not contradictory? Can they continue to take such foods like ginger, etc.? Very, very difficult question. I think he must be a lawyer. Now, the first important thing, let us come to Folitrex. Folitrex, to be frank, to all of you ladies and gentlemen, is not immunosuppressive drug. It does not suppress the immunity of the system at all. That's very, very important. Immunosuppressive drugs are high dosage of steroids and medications like we use in malignancy like azathioprine or mycophenolate, some other drugs. Folitrex is not an immunosuppressive drug. It is absolutely a wrong notion that Folitrex is immunosuppression. And taking immunoboosting substances will not interfere with the action of Folitrex at all because it is not an immunosuppressant. But I can tell you the best diet to prevent COVID infection, to act as an immunostimulant in the world at present in this COVID pandemic is your grandma's diet. Get back to ginger, get back to turmeric. See, we people, as we grew, we thought we have evolved into modern science and we have forgotten the Stone Age. But let me tell you one thing, remember this very important fact, old is still gold and old has withstood the test of times, and even in the newest times, old is still gold. A good diet will be like ginger, turmeric, cereals, and all the other things you can take like pepper, etc. That's very important. A person is asking, Doctor, I'm HLA-B27. I'm taking exact 90 whenever I feel too much pain in my back. 4 years ago, I'm continuing to take it. So let me tell you, I will address this question in the next meeting where I will be speaking to you about spondyloarthritis or ankylosing spondylitis, where HLA-B27 treatment has got a relevant role. I had typhoid fever completely cured, but getting more low back pain. Could you suggest the medicine during lockdown as we are unable to consult the local hospital? I'm extremely sorry that I should not give treatment just across like this. In just a question like that, you need to see a doctor, but so many rheumatologists are also available online. You can always consult the rheumatologist for that, but there is no correlation between typhoid fever and low back pain. And you also said the X-ray report is normal. Be gratified that the X-ray report is normal. But what I would suggest in this COVID times, even if you're not able to consult the doctor in person, so we should understand that doctors also are human beings. Like I am a person who's 67 to 68 years old, who worked in a hospital from 9 a.m. in the morning to 12 midnight. But of the last 8 weeks to 10 weeks, I'm stuck at home, working at home and working with home. Because we are all very susceptible and risky to develop COVID infection. So we doctors also are at risk to develop COVID infection. You are also at risk. But now when things become easier, all of us will be back to the playground. But let me tell you one thing, if you cannot see a doctor, you can always get teleconsultation, because telemedicine is now the art of the day, and gone are the days when people need to see a doctor very absolutely, personally and physically be examined. I am 70 years old, doctor. I am suffering from severe feet side pain. Yes, 70 years is an age when the joints get worn out. You have to consult a doctor to find out whether you have flat feet or whether you are wearing and tearing down of the joints of the feet. You have to see a doctor. You have to see an orthopedic surgeon if needed. My left leg, my leg, big toe pain, I have knee pain. Can you please tell me, doctor, can I go for walking with knee pain? This is a question. People with bearing down at the knee joint are obese. We'll tell them reduce your weight, but they'll say we cannot walk. How many hours you want to walk? I want to walk for 1 hour. There is no rule in the world that you should walk for 1 hour. Science has proved half an hour walking is important. I do not know why people want to go Padayatra daily for 3 hours and 4 hours. It's not needed. You can do all these heroic measures probably, I think, in the moon when there is no gravity. I don't know whether there's gravity in the moon or not. I'm not that knowledgeable. But let me tell you, half an hour walk per day you can do. If you have knee pain, you can walk up to a distance which is bearable. The moment you develop the pain, you take rest and again walk if it will move. That's what you should do. But just because you have knee pain, doesn't mean you should not walk at all. You can get exemption like income tax. I'm exempted from walking. It's not at all like that. If a person with knee pain is unable to walk, it's an indication to see an orthopedic surgeon to get a joint replacement done. Any recommended diet to prevent for younger generations? If it is a person who's just recently married who's asking me a question, I prefer that you do not eat the food cooked by a wife. You cook your own food and take. There is no specific diet for arthritis at all. There's only in one condition called gout, which I shall discuss later. But all patients with arthritis should have a well nutritious diet, well balanced calorific diet, and they should keep the normal body weight. Next question. I get pain in my shoulders with that headache. There's a little vague connection between the head and the neck. So you'll have to see whether you are a very tense person. You may have to see a rheumatologist and find out what is the cause. If mother has arthritis, can the child have arthritis? Very good question. Very good question. In fact, I missed this question. Is arthritis hereditary? So the autoimmune arthritic conditions are hereditary to less than 1%. There's only about 0.5 to less than 1%. Common hereditary conditions is rheumatoid arthritis and a disease called ankylosing spondylitis and gout. All the other conditions are not hereditary. But please tell me, and I'd like to tell you one important point here. No vaccine has come for any arthritic disease as such. We are struggling to find a vaccine for COVID now. I hope creator's grace, the creator who created the COVID virus will also create the vaccine against the COVID virus. Let's pray for all that. But there is no vaccine. And can you prevent it in the child? You cannot prevent the child developing an autoimmune disease. Only thing, children can be asked to play. Nowadays, I have never seen children play outside at all. When I was a child, I was only outside but never inside the house. Now I see children only inside the house but not outside the house. Glued with cell phones, computer games, etc. COVID has also imprisoned them within the four walls of a room with classes. Children should be allowed to play. Physical activity is very, very important. Yeah, we finished that question. This question is over. So I've come to the end of the question because no more questions are there. We have just 2 more minutes to go. The 2 more minutes, I would like to give a carry home message. Number 1, arthritis means pain in the joint or structures surrounding the joint. How many types of arthritic diseases are there? 180. Cause for arthritis, autoimmune, uric acid, infection, degenerative. Commonest you see in India, rheumatoid arthritis. Rheumatoid arthritis commonly seen more in women than men in the age group of 20 to 45 years. It is an autoimmune disease. Clinical presentation of rheumatoid arthritis is pain and swelling of the joints with difficulty in moving the smaller joints of the fingers and toes. Go to the doctor with early morning stiffness. Doctor looks you up for arthritis, does the rheumatoid factor. Treatment for rheumatoid arthritis, symptomatic relief with painkillers and steroids. Painkillers and steroids have side effect to be taken only under the supervision of a doctor. Taken for a long time, steroids are very dangerous medications. Painkillers taken for a long time can knock out your stomach, can knock out your kidney, so you have to take it under doctor's supervision. And blood tests have to be done repeatedly at frequent intervals, at least 8 to 12 weeks when people are on painkillers. Controlling the disease process, hydroxychloroquine. Wonderful drug to treat rheumatoid arthritis and other rheumatological conditions. Absolutely useless to prevent COVID infection or treat COVID infection. Hydroxychloroquine is safest in all rheumatological patients, disease patients in the COVID times, nothing to get worried. Methotrexate, a wonderful darling drug of the rheumatologist, which is a drug given for cancer, is very, very useful to treat rheumatoid arthritis. It is only given once a week, not to be given in a lady who wants to have a child or a man who wants to have a child or anybody who wants to, or the breastfeeding mother. That's important. Biologics are the wonderful drugs of the day. Patients need doctor-patient education. Patients will be educated about the chronic nature of the disease. Disease is not curable, but only controllable. No school of medicine can claim that I can cure rheumatoid arthritis. Till date, I don't think it is possible. There are drugs available which may cure. I may not be there at that point of time. I will see it from heaven or hell. But definitely wherever I go, it will be heaven, taking into consideration the present hell in this world. Physiotherapy is very important. Lifestyle modification is important. Correct posture is important. Well-balanced, nutritious diet. The most important thing which I like to tell you is all of you be physically active, because ultimately the last word as a rheumatologist I like to say, life is mobility and mobility is life. With this, I like to tell a very important point before you. A poetry which I read, which I probably wrote in my 7th standard or something like that. It's called When I Was Dying. When I was a child, I was dying every day to study very well. When I got into college, I was dying every day to excel in academics. When I joined work, I was dying every day to reach the top of the ladder. When I got married, I was dying every day to settle my family. But now I am really dying. I've forgotten how to live. So what is very, very important? Adopt the principle of the Buddha. The present is the most important gift which God has given to you. The future is uncertain and the past is history. So I would say the past is history, the future is a mystery, and what is available to you at this point of time is only the present. Experience is present, enjoy the present and be happy. I hope that you were with me for the last 1 hour. You were in the present. Your mind was not drifting what I should go home and cook, what will my child be doing, what will my mother-in-law say or father-in-law say or my husband say. I tell you one thing, live every moment, because this moment which has come only to stay, and it will become history soon. Thank you very much. I look forward to another presentation, 3 more presentations I have in rheumatology, ergonomics, etc. And I hope that you will definitely come and listen to me, because I have nobody to speak to. Then I'll be called as insane and will be admitted in a mental asylum. Thank you.